Hello, everybody. Thank you guys for coming and joining us on our live discussion for mental health. I'm going to let our panelists, well, our panel guests, and our moderator introduce themselves. Whoever wants to go first, you can.
Okay, I'll go. Hi, everybody. I'm Autumn. I am a mental health counselor in the private practice setting, and I am also a doctoral candidate at Baylor University, studying Black women in counseling.
Hi, everybody. I'm your moderator for tonight. I am Ethel Clark.
Well, Ethel Clark, what do you do?
I work for the Supreme Court Justice at the courthouse, and I'm also actually studying to be a Christian life coach at this moment.
Wonderful. Well, thank you, ladies, so much for joining. I greatly appreciate you all. I don't know if my live video is stopped, but that's okay. We're gonna keep it going.
Keep going.
We just have a few questions that we would like to discuss and have you answer. And moderator, you don't have to just moderate. You can join in on the discussion as well. Okay. All right. So, Autumn, can you break down the meaning for us of mental health? Like, what is it all covered?
Yeah, mental health covers a whole bunch, but if I could put it into just like a few words, I view mental health as like a whole body experience. So we experience our emotions, our feelings, whatever comes up for us, it's felt in a part of our body. If you really pay attention, when you get angry, where are you getting hot? And when you get sad, where are you feeling like pain or just heaviness, right? So it's a whole body experience, and it really is working to achieve the ability to regulate yourself in a healthy way. So not just flying off the handle, getting physical with people or anything like that, but really being able to process our emotions and deal with whatever comes up in a healthier manner than what we know before.
um Going off of what you said, like what are some suggestions for that you give to people or you would give to anyone to start to recognize, to say, okay, well, I'm angry, what's happening with my body? Like, what are some ways that we can get ourselves to come out of those trigger points to recognize what's actually going on with ourselves?
Yeah, I mean, well, of course, I always encourage to go to counseling, but um, things to do at home, really start meditating. And meditating doesn't always include like sitting in a corner and sitting crisscross applesauce and closing your eyes for an hour each day. No, it could be as simple as being mindful, walking and feeling the things around you, really feeling and getting in touch with your body and your mind to be able to monitor, okay, if I met with a situation and I'm starting to feel some type of way in my body, or, I'm having some thoughts, then okay, this is a trigger point. Let me back up for a minute and really think about this. So the first tool is always seek counseling. But if anything, and you can Google some of these tools too, like mindfulness practicing, meditating if you want to, and even there's some tools like I love Pinterest. I don't know if anybody else likes Pinterest, but there's
I
always
100%
tools.
love Pinterest.
Yeah, yes. And there's some activities on there that you can use too that could help you get through some of those tough times to start recognizing your emotions and how to process them in a healthy way.
I love that. I've been talking to the girls about practicing mindfulness, and to have a positive self-talk statement so they can retrain their brain, excuse me, to not talk to themselves negatively. Like, even when they mess up, it's okay to mess up. It's okay to make a mistake. We learn from our mistakes. And I've been telling them that, you know, when we fail, we've been trained to think that that's the absolute worst thing ever, is that, oh, you failed, so whatever. No, you failed so that you can learn from that mistake, that failure, and move to the next thing.
Yes.
And that's the only way we learn sometimes, is to make a mistake. So I love that you brought up the mindfulness. I myself am trying the mindfulness and the sitting in the corner with my legs crossed, thinking that I'm gonna be like, it's just
Right.
30 seconds and I can't get past the 30
Right.
seconds because I'm trying to wait to 50 different things of like, girl, why you here like a little baby Buddha? Get up and do something with your life. Nothing against those that do Buddha and love on Buddha. I don't have nothing against y'all, but I don't want to look like them.
Right.
Can you prevent mental health issues or problems?
Sadly, in my opinion, and with research, no. Usually, a lot of, if you're not born with certain things, because some things are, genetic, or through traumatic experiences that we have that trigger some of our mental concerns or illnesses.
Mm-hmm.
Usually they just happen, just like life happens. As
Mm-hmm.
we go through things, we deal with them differently. And sometimes anxiety can pop up with an event that happened in our life, or depression can pop up. Also, a lot of times, some mental disorders they show up later on in life.
Mm-hmm. Okay.
And so we can go years without knowing if something's really going on until we hit about 25. And then that's when you start noticing, okay, my behavior is changing. What's going on?
Mm-hmm.
So we can't prevent it, but there are ways to help us be proactive, to treat whatever's going on.
Oh,
You said
oh,
that
sorry.
we can't prevent it, but if you know that there's a family history or something, is there a way that you can be proactive to calm it down?
Yes, definitely. There's definitely different treatments. So, like, for example, a very common diagnosis people get is ADHD or ADD, right? So we have medications in place that children can take. We have therapies if people don't want to have medication as their treatment option for ADHD. So that's a proactive way to get things going. Once your child is born and as they get a little bit older, you see some behaviors happening, or that this is you have family history with this, then you can go to the doctor or therapist and say, hey, I know this is a thing that all of my family has dealt with. What can we do? So there's definitely some disorders or struggles that can have some preventative methods. But usually the ones like anxiety and depression, they just come about as life happens. So that was a good question. Thank you.
Thank you.
What are some first signs? Because some people don't know that they're depressed. Um, so what are some first signs of recognizing that there may be depression?
Yeah, so one of the main ones is lack of motivation to do anything. So if you're usually one to want to go on a walk, work out, you want to go to work, you want to socialize with friends and family, if you notice that you have, no interest in doing that, that's a clear
Mm-hmm.
sign of something may be going on. Another big one is just being tired. So heavy fatigue all the time. I know some people who have just been in bed for 24 hours in the dark. So if you see those, and it can creep up on you, so
Mm-hmm.
seeing those signs really could be um, a red flag to, okay, maybe some depression is coming my way. How can I handle that, going forward?
Okay. So if you notice those things with other people, how can you help a friend that you see that is struggling to to maybe even point it out to them and not, and because I think that that's a sensitive topic, and I think that
Mhm.
there should be some sensitivity when it comes to that. So how do you address that with a loved one?
Yeah. A big thing is just asking how somebody's feeling. And I know we get so caught up in saying, "Oh, I'm good, like I'm fine." And
Mm-hmm.
we really need to hold each other accountable and being honest and sharing how we truly feel. So
Mm-hmm.
when you're coming up to a family member or a loved one and you're like, "Hey, how are you doing? Like, is everything okay?" If they give you a blanket answer, a really nice way to approach it in an understanding and non-judgmental way is like, "Hey, I've noticed you've been, tired, more tired lately, or you haven't come around the family or
Mm-hmm.
our friend group um, lately. Is everything all right with work? Is everything all right at home?" Really naming like specific things to get that friend or family member to see, okay, maybe people are noticing my behavior is changing. Is something going on?
Right.
Because yeah, if you approach it kind of like, "What's wrong with you?" You just been different. You changing up on us. That is not a
Yeah.
way to approach the situation. And then people get
Right.
offended on that.
Mm-hmm. I know I would. I ain't even gonna lie. Like, I mean, I'm gonna be transparent through this whole thing. Like, I've been depressed, and I might, from what you're saying, I might be depressed right now. You know, like,
Mhm.
I don't want to do anything, but I am one that likes to go out and do stuff. I love to socialize. I love to be around people, and lately I've just been like, I don't want to do anything, and that's why one of my goals for this year was to make sure that I went out to lunch with at least one of my friends once a
Yes.
month to push me to get out there and to do something and to be around people. I live by myself, so it's easy for me to be like, I ain't doing nothing today. I'm gonna be in the house.
Yeah.
And so for somebody to come and ask me in the way in which you're asking to say, hey, I noticed that you want, instead of what's wrong with you? Nothing is wrong with me. And my mom say all the time, it's not about what you say, it's about how you say it and how you put it
Yeah.
in a way. And a lot of people will say, well, we're making soft people. Yeah, in some instances, some people are soft, but in other ways, it's all about a respect thing. And how can I help you to get to make you, to let you know that you can trust me? Because sometimes
Mhm.
you can't trust everybody with that emotional piece because they don't understand. And they don't understand because they don't want to. Sometimes I feel like people just don't want to say, oh well, that's fine. And this is no hit against Christians, because I'm a Christian. I love the Lord. I do 100%. But Jesus gave us wisdom to be able to go and
Amen.
get this help from people. And for us to
Mhm.
just keep saying, God gonna make a way. Well, He is, but how we gonna know what we need to call out? How do we know what we need to talk about? How we gonna know what we need to ask Him if we don't know what's wrong? Like
Mhm.
He wouldn't have gave doctors or let them be that if it wasn't a reason for it. You know what I mean?
Exactly.
So that's just where I'm at on it. This is my personal opinion. It's nobody else's. um, so are there cures for any type of mental disorder, or are there just tools that help to get through it or to do life with it?
Yeah. Some people, I guess, it can be viewed in different ways. I'll share my view and then I'll share what some other people think. But personally, I don't believe there's a true cure for anything. I mean, there's some more severe disorders than others, but
Hmm.
there's only just ways to cope, tools to learn how to get through these things. So yeah, you can work through it, get better, take the medication, go to counseling, whatever you choose to do. So you get those treatments, you feel better, but that doesn't mean it's never going to come back. But if it comes back, whatever it is, you now know what to do. So that doesn't mean you have to go back and get medication or go back to counseling unless it's really, really severe.
Mhm.
So there's no true cure for I would say the mild disorders. It's always going to have that lingering effect. But there's definitely progression that can happen.
Mhm.
The other side of that is, some people can have anxiety for 1 month and it never happened again. And so then they say, "Oh, I'm cured. Like I'm good. I'll never have to deal with that again." And that just depends on like if it's a major life event that
Mhm.
happened and they're just getting through that, then okay, people can view that as a cure. But really, is it really gone? Like, what if it happens again? Then
Mhm.
you're still dealing with those things, right? So there's treatments, there's tools, but not a real cure for any of the things that I see at least come into my office.
Okay.
So I have another
Uh.
question. Going back to how we can help people. So, say it's not a family member or a close friend, but how can we help those that we work with, but we're not close with? Like, if we see that there's a change, like they're coming to work late, their attitude has changed, but we don't have like a close relationship where we can go up to them and say, "Hey, I see there's a change in how you act. Then how can we approach them to give them some help?"
Yeah, that's a good question. I think again, just approaching it with an understanding, like non-judgmental tone, of course, and just saying, hey, I know we don't talk all the time or see each other all the time, but lately you've seemed a little down. Like, is everything all right? Do you need me to help you with anything? Do you want to go somewhere else and talk for a little bit? Just opening up yourself as a sounding board for that person is always a great tool to get them to open up and share with whatever they're going through. And that way you can say, okay, well, have you considered counseling to help you? So just, you know, making sure you're coming off as like, I'm not trying to be rude, not trying to offend you, but I've just noticed this. Do you need any help?
Okay, that's good.
That is definitely good. I was gonna say something, but I'm gonna wait. So, we've been saying this mental health is real and all of these things, and there's been an increase to push the awareness so that people know mental health is real. I mean, we know it's real, we see it.
Mhm.
So why do you think that the push is now greater than it has been before, or has it always been like a great push for it and we just never really saw it?
Yeah, I definitely have seen an increase just like we all have. I think it's definitely stemming from generations. As, more generations come, the more aware we are of social issues and things going on in our world. So the younger the kids are, they're bringing these issues up and talking about them more than previous generations, right? Um,
Mhm.
and that's due to just social media. We haven't had that,
Mhm.
but for the last mm, almost 20, 25 years, it might be pushing it, but it's been a while. um, so, and research and mental health, it takes a while to understand these things and really
Mhm.
get them out there. So with social media, it's getting those things out faster. So where the increase for awareness is coming at us at a quicker rate than other issues have. And then also just growing health concerns in different populations of people um, are coming out now because we've been a very closed off society, very closed off in our cultural backgrounds, ethnicities, to where we don't talk about these things in the past. And now we're like, okay, I'm noticing that more and more people in our family are dealing with this. What's going on? So it's definitely just the more we educate ourselves, the more awareness is coming about.
Do you think that there should be some kind of education put into schools, like a little bit more than what they're doing to educate the youth so that um they aren't picking on the kids that are going through, or that they recognize that this is what's really going on, that this child is really going through, or this teen is going through?
I definitely think that should be incorporated in all courses that teens or children take. Of course, age appropriate, but especially as we get into that adolescent, going into adulthood age, because that's the most prime time for those, that peer pressure coming in. So that's where a lot of mental concerns come in with anxiety and depression. So just not even, because I feel like when you really think about it, when we were in school, we were told or shown the most severe cases of things that can happen around mental health to scare us out of doing those things. So you never really hear the more mild things of, this is just general anxiety. Are you nervous taking a test? This is why. Do you have things going on at home? This is why you react this way at school. So I definitely think just having conversation, even if it's not built into coursework, but just making sure teachers are open, aware, and educated to help youth should be a requirement.
I'd agree. I've been working with kids since I was a kid, but professionally since 2009. And it's a lot. I mean, they go through a lot. They have a lot of traumas that adults don't even go through. Some adults don't go through. They don't have to deal with. And then being a foster mom and the things that I've heard. And I was taught some things that I should have been taught by a child, because I felt like that child should not have known that. However, she knows it. That's been her life. That's been what she had to deal with. And it's just, I feel like for some, they rather pump them with medicine than to help them get to what the root cause is. Okay, if medicine's going to help them in this journey, then I feel like, go ahead, let's do it, right? But I think that getting to the root cause of the trauma, the things that we blocked out, the things that we don't want to remember, the ugly pieces, is very important. I think it's essential. We talked about it in our our self-care. We talked about getting to the ugly so that we can move on into the next. Some people in the Black and brown communities believe that a mental health condition is a sign of weakness. How do you ensure them that that is not true?
I'm sorry, it was cut out. The sign of weakness, mental health.
Oh, yes. I'm just gonna read the whole thing.
Sorry, it kicked me off. I was like, what the world? Okay.
It's okay. Some people in the Black and brown communities believe that a mental health condition is a sign of weakness. How do you ensure them that it is not?
Yeah. Okay. So again, conversation is more impactful than we think it is. And the way I approach it, especially with my Black clients, is just saying this is a strength. Like, you just walking in the door is the step in the right direction. Because we don't want to continue the patterns that our community has honestly been forced to create. So definitely talking through those things and reminding people that the only way we get stronger as a community, as individuals, is talking and healing through our issues. And so that's not a weakness to go ahead and let that cry out. That's not a weakness to say, hey, I'm dealing with anxiety and depression. That's a strength.
Mhm.
And that's
Right.
educating the rest of our people, our younger people especially, that it is okay to share our emotions and go through tough times and have somebody to lean on when we have those tough times.
What do you feel are barriers to people actually going out to get help?
Oh, there's so many. I think the main three I would say that I've seen is access to mental
Mhm.
health resources. So, you know, when you really think about it, where are most of the private practices located? Where are most of the clinics located? A lot of times they're not even in walking distance for some people, driving distance for some
Mhm.
people. So that lack of access and then the funds to pay for it.
Mhm.
Some clinicians don't take, um, you know, assistance of insurance. Some people don't even take insurance, period. So being able
Mhm.
to afford mental health services is also a barrier. Knowledge about mental health. I
Mhm.
think a lot of times communities just put it off as um, something that's needed for other people and not them. So they
Mhm.
don't think to really read into these things or even look at social media posts about them. They just ignore it. So
Right.
increasing some of that knowledge would definitely take that barrier away. And then the last one, I think, that's a big barrier is just willingness to change and willingness to actually walk in the door and start doing the work. That also comes from the influence of our community and our family members. Not to blame
Mhm.
families all the time, but our family has a big impact on who we become in the future. So just making sure that we're being
Right.
open to talking about mental health and getting the help is a main thing to break that down.
Were you gonna say anything, Miss Clark, before I started talking? Because I saw your mouth open.
I I think that it's truly those are truly great barriers. And I think that one of the other barriers and that is the stigmatism that comes with that. You
Mm-hmm.
know, in the fact that there may be medication that someone has to take. Um, and a lot of people don't want to take that. They think that it may be an addiction or something. So as another barrier that it's so like you said, the barrier process is so big that
Mm-hmm.
it's unbelievable. But there's a lot of barriers in our community that stops us from going. But knowledge is very much one of the biggest ones. It's just knowledge, educating themselves.
Mm-hmm.
In a transparent moment, again, I will say that for me, it was the willingness to go. Um, I don't want nobody all up in my business. I don't want to put myself out there for somebody that I don't know. But when I went and I actually started talking to someone, and I talked to different people, it was just like they're non-judgmental. They don't know me, so they're going to tell me the real. They are, I guess, sympathetic maybe or empathetic. I don't know which one I would want to say, but they didn't pity me in my situations, and they allow me to talk about things that I didn't feel like I wanted to talk about with anybody else.
Mm-hmm.
And that was the ugly pieces that I had to come to terms with in order to start my journey to growth and to getting on a place of where I feel like um I'm healthy again.
Mm-hmm.
Because I'm on this thing where everything in your mind is where everything starts in every thought and everything. And if my mental is so clouded and I can't even think. Sometimes I couldn't even sleep because I had so much on my mind. It was just like going and talking to them gave me like such a peace, you know, and it was over time. I've been doing it
Yeah.
for a year. So I agree that willingness to actually put your foot down or to just step in the door was 100% the thing that was keeping me, because insurance pays for it. The doctor's office that I was going to, they took my insurance, and so I had access. I had the resources. I my mom been telling me for years to go and get counseling because of things that went on in my life. And you know, it was just going.
Yeah.
Sometimes that's just a major hump that's keeping people from actually getting the help.
Exactly.
So, but yeah, we will definitely need to do a second part, and get some more people on the panel to discuss and talk with you and talk through some things. The main thing will be the barriers, and how to overcome the barriers is a piece that I'm really interested in and wanting to talk about, and how we can get some things put in place to, you know, maybe start some kind of something, you know, like it has to start somewhere. And where can we start it, and who can we start with? We start with us. We start with ourselves, and helping to spread the knowledge, and not just with the young, but the old and the older. Because I'm pretty sure they have traumas that they probably are never going to talk about. Because what happens in their house stayed in their house. What happens in their family stayed in their family, and you don't go out talking to other people. But I think some people are seeing though that they need to, and that it is helping. So I wanted to thank you both for coming on and speaking with us. And thank you all out there in Facebook world and YouTube land for watching. If you watch this later, put hashtag replay, put your questions in there, because we will be doing another session. And when we do the other session, I'm gonna have all those questions ready to go. So that Autumn, because we're gonna get Autumn to come back. She don't know it yet, but we're gonna get her to come back. And we're gonna get her to bring some of her friends to come back and have this conversation with us. If you would like to follow Mac Mentoring, you can do so on all social media platforms. It is at MAQ Mentoring. Thank you so much for coming in.